Hi, my name is Dr. Sam Richardson, and this is the lower extremity DVT video for the bedside review series for Mount View Hospital. As a reminder, these are short videos for rapid review prior to performing point-of-care ultrasound and are not a substitute for full didactic experience. The point-of-care lower extremity DVT ultrasound is typically performed with either the linear or curvilinear transducer. The primary purpose is to identify or rule out deep vein thrombosis. In patients with larger lower extremities, it may be necessary to use the curvilinear transducer to obtain adequate images throughout the extremity. When performing a lower extremity DVT exam, it is important to expose the entire affected leg. If you use gel packets, we recommend that you empty the entire gel packet on the patient's leg by running a strip of gel down the medial thigh. Start in the inguinal region and identify the common femoral vein at the junction with the greater saphenous vein. Move down the leg, fully compressing the vein about every 2 to 4 centimeters. On patients with larger lower extremities, switch to the curved probe when the linear probe is no longer obtaining adequate images. If compressing with the probe becomes difficult or is ambiguous, consider reaching around and compressing the patient's leg into the probe. Once you have reached the distal femoral vein, you should switch to the back of the knee to image the popliteal fossa. Unlike the rest of the femoral vein, the popliteal vein is closer to the probe than the artery. You can remember this by saying, "The pop is on top."